Welcome to today's edition of Business Talk on ABC5.
Dr. Gostich, what does your specialty bring to the Wound Healing Center?
As a podiatrist, I think that we've been on the forefront of wound healing for many, many years. Podiatrists here, the three that are in this office, have a combined total of approximately 100 years of wound treatment already, mainly with diabetic foot wounds. It's very important that we also practice in a facility where all different specialties that are involved with wound care are represented. And this gives us a unique ability in this wound center to do that complete treatment for the patient instead of having to send them around to different offices and them having to follow up on their own accord. We've got patients that are seen here and they can have all the treatment rendered here with very specific treatment regimens and plans implemented. In general, we perform mainly the relatively minor procedures. We do some debridement, which is a French term for taking off some dead tissue that is not too involved, but most of the more involved procedures that involve underlying bone and underlying deep infections need to be done in the operating room. Offloading is a very important topic, and I spend quite a bit of time discussing this topic with patients and especially their families. It's incredibly important that the patients, as far as a diabetic foot wound is concerned, take the pressure off of that wound on a 100% basis. We find that the shearing forces of a wound are something that are very detrimental to the healing properties of the wound, and although patients down here especially have this conception that antibiotics are the holy grail in terms of wound care, they don't really do that much. But the offloading is a very important aspect of it, and we spend quite a bit of time and different types of apparatuses to try to get them off that foot.
That's all for today's edition of Business Talk. Stay tuned. Next time on Business Talk, hear more from Imperial Valley Wound Healing Center.